Hey everybody, this is Dr. Bulow with Revive Upper Cervical Chiropractic, and I wanted to actually just shoot a quick clip. I was looking at a patient's MRIs and CT scans, and welcome sick docs. I just wanted to do a real quick analysis. I want to show people something maybe they haven't seen before. I'm looking at a patient's MRIs and CT scans right now, and there's just some pretty neat things about it. This is a CT scan. And what you're looking at is the top couple of bones in the neck. This picture right here is actually the second bone down. If you were looking at the camera here, it would look like this, right here. But if you're looking from the top down, it would look like this right here. Or from the bottom up, it would look like this. See that? So that's what you're looking at. And so your spinal cord goes right through that opening. And one of the things that I was looking at was the relationship. Now watch this X. Your spinal cord goes through the X, right? Now watch this. We're going to go up a level to the C1 bone. This C1 bone, this ring right here is the C1 bone. That is this bone here like this. Okay? And so you have the C2 like here, and then C1 here. And that's where your spinal cord goes through this little opening. Okay? Look at this crosshair here. See this crosshair here? Now look at that and compare that to this crosshair here. You see how it's twisted? So C2, this bone here, is sitting like this, just the way it should. But then we go up to the top bone in the neck, and look at that crosshair. This top bone has essentially twisted over to the side. It's twisted. It's like putting an Indian rug burn on your spinal cord. And when you have that twisting going on at the point where your brain is, for goodness sakes, that can cause some trouble. And so this is something that we look at in chiropractic, in what's known as upper cervical chiropractic. We look at the top two neck bones and just the relationship. Look at this. It looks like a cross. You got a vertical line and a horizontal line. That's exactly what it should look like. And then you go to the bone above that, the one that holds your skull. And then this is the very top bone, and you can see how this crosshairs here is twisted to the side. And again, just to show you the real bones here, this is the second bone, and what you're seeing over here is the first bone. And essentially what's happened is that it should be a nice opening like this, but it's been twisted to the side. And imagine your spinal cord going through this opening and it's twisting it. It's like putting a kink in the garden hose. It's like putting an Indian rug burn on your finger or an Indian rug burn on your arm. And these little changes that we see, these little minute little millimeters and degrees of misalignment, these are not things that most radiologists are looking for. Most radiologists are looking for tumors and fractures and things like that. These tiny little twists and turns often get overlooked. And the trouble is that area that you're looking at there, that area is right at the top of the neck and the bottom of the brain. Right? So there's the brain. And that one area, here's your spinal cord. This is an MRI. There's your spinal cord. And there's that top bone protecting that spinal cord. So if that area is twisted, boy oh boy can we have some trouble. And so I just wanted to share that for anyone interested. Just looking at a couple of patients' MRIs and CT scans, and I thought maybe that might be something of interest. Here's another view here. This will be the middle of the brain here. And so that little twisting, we were looking straight down a moment ago at this opening where that spinal cord is going through. And so that's what it's all about. So welcome to the broadcast. I was just going over a quick CT scan and an MRI. I was in the clinic here, and I just thought it'd be interesting. Some people have never seen that before. If you're interested in learning more, you can go to revivepittsburgh.com, or you can go to facebook.com/revivepittsburgh, or you can follow me here on Periscope, and I'll be doing different updates. On Tuesday, we're going to have a talk based on your discussion. So if you guys have any conditions or diseases that you're curious about, or things that you want to talk about, just let me know. You can mention it right now, and I'll take note of it. Or you can send me an email, or you can send me a message on our Facebook page, facebook.com/revivepittsburgh, or just message me right now on here, and I would be happy to discuss that on a given Tuesday. Any questions with that? Any questions with the CT scan or the MRI before I log off? Hopefully you guys have got a little extra knowledge out of that. Maybe something interesting you've never seen before. And we look forward to talking to you again real soon. Take care.